everyone, so today I will be performing the assessment of the heart. So the needed equipment for this assessment is a stethoscope for auscultating, a skin marker for putting a dot in the skin of my patient because I will be using this centimeter ruler to measure if there's something inaccurate in the skin of my patients. Okay, so before I take this video, I already closed the window and door for the privacy of my client. And I already washed my hand to prevent the transmission of microorganisms. But to make sure for the safety, I will be performing the hand hygiene using alcohol-based sanitizer. Okay, as you can see, my client is a child, but don't worry, I asked the permission from the parents and they agree. Okay, so I will be asking my client and I will be using the subjective data for that documentation. Good day, ma'am. I'm Abigail Sarong, a student nurse, and today I will be assessing your heart. But before that, ma'am, I would like to ask some questions for the purpose of the documentation. So, is it okay with you, ma'am? Okay, ma'am, thank you. So, do you have a family history including cancer? Okay. Diabetes, hypertension, or any complication with regards to the heart? Okay. Do you take any medication? How about a current problem like varicose veins and like ulcer? Okay, ma'am, thank you. Okay, ma'am, so now we will going to start the assessment and I will be looking at the vein in your neck. For that, I need you to lay down, ma'am. Lay down, please. At the 45-degree angle. Okay, thank you, ma'am. Okay, so now, ma'am, please turn your head to the left. Okay. Thank you, ma'am. Okay. So now, I am looking at the vein in your neck, ma'am. And it's flat, so probably it's normal. But if you see that in the vein itself is large or bulking, that means indication of an increase in pressure which can be abnormal. Okay, ma'am. Now, you may now go back in your sitting position. Okay, thank you, ma'am. Okay, ma'am. So now I will be palpate your carotid pulse and I will be placing my finger next to the trachea, which is here. Okay. And above in the midway of the neck, I am feeling of the strength of the pulse. Okay, a normal strength should be 2+. I am also feeling for the upstroke. It should be nice and smooth and strong. Okay, then I will be doing this also in the other side of the neck. And I feel it's same. Okay, so now with the use of my stethoscope, I will be listening on the carotid artery. I will be listening for a bruit, which is a squeezing sound, and I will be listening with the use of the bell, of my stethoscope. Okay, because the bell is the part of the stethoscope that can hear a low pitch of sound. So, ma'am, I will be placing the stethoscope above halfway of your neck. Okay, can you, ma'am, can you breathe in and out, then hold. Okay, so I am just hearing a pulse and not a squeezing sound. Now I will do it in the other side. Take a breath in and out, ma'am, then hold. Okay, so I just hear the pulse and not the squeezing sound. Okay, ma'am? Thank you. Okay, so now I will be inspecting in the hand of my client if there is some bruise or lesions. So, ma'am, can I see your hand? On the other hand. Okay, so as far as I can see, none of them is present. Also, I will be inspecting in the feet. Okay, ma'am, can I see your feet? Okay, on the other side, please. Okay, so as far as I can see, none of them is present. So, as I touch the skin of my patient, the temperature is warm. Okay, so I am looking at the presence of edema. So, ma'am. Okay, so as I touch in the hand and also in the feet, the other side, ma'am. Okay, so as I touch in the hand and feet, I must say edema is absent. Okay, so thank you, ma'am. Okay, so now I will be checking the chest. So I'm looking at the precordium. So the precordium is the part of the chest that is overlies in the heart. I also see the normal respiratory movement, and then I am going to palpate the point of maximal impulse, which is in the mid-clavicular line, which is here. Okay, so in the fifth intercostal space. So if I put my finger here, okay. If I put my finger here, I feel here at the ribs. So if I put my finger at the ribs, I feel between in the ribs is the pulse. Okay, ma'am. Okay. Okay, so now I will be finding the second intercostal space. Okay, so which is here. So I may be either count down from the clavicle area. So there is a space of 1 and 2. Okay, or I may be find the angle of a Louis. So this is the part. So this is the part of a sternum that is protrudes a little bit and a right across, for there is a second intercostal space, which is here. Okay, so now I will be auscultating. So I'm going to start in the aortic area. It is here. And I'm listening for the S1 and S2, which is the love dub. And I'm listening for any clicks or extra sound or murmurs. Okay. So, right across from that is the second intercostal space. To the left of the sternum in the pulmonic area. Okay, then I move down. So I'm going to listen in the fifth intercostal. So just right next to the sternal border. Okay. Then finally, so at the mid-clavicular line in the fifth intercostal space, submetral area, so which is here. Okay, ma'am. Thank you. Okay, so I heard the S1 and S2 sound, which is the love dub. And I did not hear any clicks or extra sound. And I did not hear any murmurs. So, that's all. So, that's all for the assessment of the heart. And thank you.